Hello and welcome. I'm Bob Cusack, Editor-in-Chief of The Hill. Thank you for joining us for our program today. After a difficult flu and RSV season that put pressure on healthcare facilities nationwide, the importance of vaccines to help prevent and lower the risk of severe illness once again took center stage. However, a November CDC vaccine confidence report suggests that vaccination rates plummeted during the pandemic and have yet to reach pre-pandemic levels. One of the barriers is cost, something that a provision in the Inflation Reduction Act attempts to rectify by requiring Medicaid and Medicare Part D plans to cover CDC-recommended vaccines. How might the U.S. ensure easy, efficient access to vaccinations, specifically among adults? What barriers do low-income communities continue to face in accessing vaccinations, and how do we address the needs of communities of color to reduce health disparities? We will be putting these questions and more to our panelists today. I'd like to thank our sponsor, Pfizer, for its support of today's discussions. Before we get underway, a few housekeeping notes. You can tweet us at The Hill Events using the hashtag TheHillHealth. To kick off, I'm happy to welcome our excellent panel to help set the scene and provide insights on how to eliminate gaps in vaccine access. And with that, I'd like to welcome Dr. Tochi Iroku-Malize, a family physician from Long Island, New York, and the president of the American Academy of Family Physicians. Gary Puckrein, president and chief executive officer of the National Minority Quality Forum, and Dr. Nandini Selvam, president at IQVIA Government Solutions. IQVIA provides advanced analytics, technology solutions, and clinical research services to a number of life sciences companies, including our sponsor, Pfizer. Okay, let me start off, Tochi, with you. First of all, as I mentioned, the pandemic has had effect across the globe, but specifically, how has it affected vaccination rates across the board?
All right, thank you so much for having me. I'm going to delve into that. I just want to remind our viewers that, again, routine vaccination is very, very important. I want everyone to take away that vaccines are safe, effective, and save lives, and they're the best way to prevent some of the illnesses that are out there. What we've noticed with the pandemic, COVID, according to the CDC, only 20% of adults have 19 and older have received all of the recommended vaccines, and there are about 9 recommended adult vaccines that are required. Perceptions about the vaccine also play a critical role, according to the CDC study released this month amongst adults who are 60 and older. The most commonly reported reasons for not getting the bivalent booster, which is the approved newer booster to cover the newer variants of COVID, was that they felt that they still had a strong protection against the infection, with what they'd gotten before, or they were concerned about the side effects, or they were unsure whether this new bivalent booster was going to be effective. And so investment in vaccine equity, as you mentioned, is necessary to ensure that patients can continue to access the vaccines despite the hesitancy, and access life-saving therapeutics and test to treat. That will help to make sure that our country is prepared for future variants and also to be able to treat our patients equitably.
Gary, and thanks for joining us again. You're a regular at our events. What have you seen that works? And speak a little bit about underserved communities, kind of where we are and where we need to go.
Well, thank you so much, and I appreciate the opportunity to speak with you today. So part of our challenge is when you look across the states, at the data across the states, vaccine rates differ across states. In the state of Florida, for example, we see very poor vaccination rates. Some of it may very well be associated with some of the political climates in that state. And so it's not just, it's sort of the information flow that populations are receiving in the communities in which they live. We also see some administrative problems in terms of physicians making sure that they're recommending vaccines to their patients. When we look at the data, what we can see is that in some practices, there's some need for quality improvement in order to make sure that every patient is receiving the vaccine. And then finally, the patients themselves. Again, there's a tremendous amount of disinformation, particularly targeted at underserved and minority populations that discourage them from getting vaccines. And so there's a real need for us to make sure that trusted voices in community, and we do a lot of work, for example, with federally qualified health clinics. Their board are made up of representatives in the community. They're an excellent source to help make sure that certainly those underserved populations and communities get vaccinated. So we have a lot of work to do across the country, but I would certainly call out those states where we see vaccine hesitancy to be more extreme than in other places.
Nandini, jumping off of what Gary said, in different states, there are obviously different vaccination rates. What do you think are the keys to convincing people to get vaccinated? And we're not just talking about COVID-19. We've the flu shot as well as shingles and others. I know somebody who didn't get the shingle shot and then got shingles, and that was a mistake. So what are the keys to success here?
Yeah, I mean, this is a complicated question, but it's not a new one, right? So vaccine hesitancy really has existed sort of since the beginning of the introduction of vaccines. Even if you go back to the 1800s, 17 and 1800s with the initial polio vaccine to what we saw in the 1900s. And really, there was really a period where acceptance was much better before it started to dwindle a little bit around autism and other things. So in terms of vaccines and hesitancy, it's really a continuum. And part of really acknowledging and approving it includes things like looking at financial barriers, right? Like shared decision making, cost sharing. That really has an impact on whether somebody chooses to take a vaccine, if it has an impact on other aspects of their lives. Making sure that the underrepresented, whether it's in their settings and other ways, are appropriately addressed and make sure that we get it out there. So really around financial barriers, we're looking at access to vaccines. So even in states, in certain states, and Gary just mentioned Florida and other places, there may be vaccines, but there may not be in a sufficient number of vaccinators out there to actually get it into arms. And then compressing the timelines around regulatory aspects, right? Making sure that the vaccine is available from when it first gets approved to gets into people's arms. And then the data really suggests that different vaccines have different uptake, and we can talk about that, I think, in a little bit.
Mm-hmm. Tochi, I wanted to ask you about kind of the role of education, because we are living in polarizing times, and what do you think is the best convincing argument on you're seeing on the ground with physicians of convincing people to get vaccinated across the board?
Well, what I do know is that what we're telling physicians and what physicians are doing to do, listening, actively listening, and understanding where the patient is coming from, why they're refusing the vaccine, and addressing that information. So we know that the spread of misinformation on social media and through other channels can affect vaccine confidence. And so using evidence-based science is the key to understanding the necessity and effectiveness of vaccines. Misinformation about COVID vaccine is prevalent and jeopardizes the health of the public. And so our job is to make sure that we stay ahead and stay abreast of the information so that we can share that information with our patients. That trust that's built, especially with the family physicians, and that continuity of care, having your primary care physician or your primary care clinician, whomever you're working with, having that trust factor, because you've dealt with them for a long period of time, you understand, you're trying to give them the best advice that you can based on the information you know and the resources that are available, using that to help correct misinformation, to show them the evidence, and then be persistent, just being persistent, using every single visit as an opportunity to address vaccination issues and to offer vaccination. So the key thing is making sure that our patients know that it's safe, and that if that spread of false information can undermine safety, puts the communities at risk, and potentially leads to patients foregoing treatment. And preventative care is the foundation for creating a healthier community, which impacts the economy of the community and the safety and security of that community as well.
You all have touched upon access and care and specifically cost. You know, when FDA approves something, a lot of people think, okay, then that's the end of the road. But there has to be a reimbursement for it as far as cutting down on equities and making sure everyone can get medicine. Gary, I want to go to you as far as the provision in the Inflation Reduction Act, as I mentioned in the intro. Very important because it mandates vaccine coverage through Medicaid and Medicare. What are you seeing? Are you seeing the effect of that? Obviously, that was a massive bill that had a lot of things in it, but this is an important healthcare provision.
It certainly is an incredibly important healthcare provision. I think it's early yet to see it in the data, any uptake in vaccines as a consequence of the bill. But one of the things I would point out is that prior to the bill, what we saw in the data, particularly in the Medicare population, where these were populations that were insured, but in the case of flu vaccines, what we saw that minority populations, African Americans and Hispanics, were less likely to get appropriate therapy, appropriate vaccines, which is incredible problem because it also translated into higher hospitalization rates, more severity of flu. We see the same problem with pneumococcal. We have a population that is insured, and the vaccine was available, but certainly they were not getting it. So cost is an important part of the equation, but I don't think we should walk away feeling that we've solved the problem just by how we've addressed the cost issue.
Nandini, kind of same question to you, and also, where else have you, the United States is very focused on the United States, but is that provision key, and how do we compare with other countries, whether it's on, COVID obviously is getting a lot of attention in China, they're having problems, but what have you seen, talk about that healthcare provision and also kind of models we can follow.
Yeah, I mean, that's an excellent question. I mean, primarily the data we've looked at more recently has been around the US, right, in terms of following through on influenza. So Gary just talked about flu and the disparities when you look at the different age and race ethnicity groups, right? So to be honest, complete transparency, right, as a nation, we have not done very well with vaccines in a long time, even pre-pandemic. So if you look at things like the flu, the 18 plus age group, just within the US, we were at about 44% uptake in around 2017, 2018. And then there was a little bit of a spike during the pandemic, and it's now not quite at pre-pandemic levels, but certainly lower. And then shockingly, we looked at also things like shingles and pneumococcal, which Gary also mentioned. Pneumococcal, I mean, we've seen some improvements, but it's still only at 7.5% uptake if you look at the 50-year plus age group, right? And then the last thing, and I'll get to the international one in just a second, but even in pregnancy, we're seeing that less than 50% of women get the Tdap. So really important markers. So as we talk about what's working really well, what's not working really well, the message really still is that penetration's really low. Certainly we've seen in countries like Denmark, we've seen other nations in Europe where they do a pretty good job of tracking vaccines. But I think a lot goes back to what Tochi and Gary are talking about, really, in terms of how much trust is there in the system? Are we speaking with evidence base, right? Is there a data platform that then weighs in when people make these decisions? Is there confidence in the system? And I think it's not really a one-to-one comparison in all of these places, just because I think as a nation, there's just a lot of information out there and not all of it's accurate, right? But it weighs into people's decisions and getting their vaccines.
Mm-hmm. We do have an audience question. I'm going to just open up to anyone who wants to take it. It's from David Schulke, principal at Health Quality Strategies. What are the state and community-based initiatives answering questions and explaining the risks and benefits that concern many members of the public? Any one of you want to take that one on?
So I know at the National Minority Quality Forum, we've worked a lot with faith-based ministries. Most ministries have a faith-based initiative. We've done a lot with barbershops and beauty salons because we have to engage the patient community. It is not just a provider decision. It's a decision that also has to be made by the individual patient, and they need good information. And so what we try to do is work with those trusted voices. And surprisingly, a barbershop, there's a lot of information gets passed back and forth. And so we try to make sure that those barbershops are well versed with the information and can be a reliable source. And that's really where it has to happen. Communities are different all over the country. There's no one size fits all. And so we have a big job, a big task to do to make sure that each community, and we're diverse, right? I mean, America's an incredibly diverse country. And so every community has their own attitudes and thoughts about and the way in which they accept the information. And so what we try to do is make sure that we're using community voices and supplying them with the information and then letting them translate it to their communities.
Did that surprise you? I'm fascinated by the barbershop angle that when COVID started, obviously we get information from television or our phones. Did you think that at first, that barbershops were going to be so key?
Yeah, in parts of the country, the barbershop is really a community meeting place. People go to the barbershops and almost as a form of getting in touch and staying in touch with the community. I know some of us just like to go get the haircut and get out of there, but some folks actually go to the barbershop, and they become a really reliable source, a way of distributing information. And the same with beauty salons. Women go to the beauty salons, and they pass a lot of information back and forth. So they are a tremendous resource.
Right. And if I can,
Please do,
if I may,
please do.
for the American Academy of Family Physicians, just piggybacking on what you're saying about taking advantage of the community-based resources. With the American Academy of Family Physicians, anytime we have, as we get new evidence, new information, that is shared with the state chapters, and each of the state chapters now shares it with the local chapters within those states. And that's basically arming our physicians, our residents, and our medical students with information that they can share not only with legislators, but also with the communities that they serve, so that whether it's seeing the patient in their office or, participating in health fairs, going to places of worship to share that information, and then of course we have our media ambassadors going out, whether it's on social media, trying to, address the misinformation, share positive messages, giving the correct information, and then also, answering questions on venues like this, trying to share that information, making sure that the communities out there have what they need in order to increase the vaccination rates across the country.
I wanted to ask you a follow-up question, because one of my tennis friends is a physician, and he's exhausted. What are just the last couple of years have just been so intense in so many ways. What are physicians saying, and is there a real problem because so many people are overworked?
I think your friend is not alone. The physicians of all specialties are exhausted. It's been a trying few years, especially when you're in the healthcare industry. At times people are happy with you, so at times people are not happy with you, but trying still to do the right thing for our patients. I believe, though, for those of us who are in medicine, we're still pushing forward. We still want to do the best for our communities. We still want to make sure that we advocate for policy solutions, making sure that there's access for our patients to support better integration of primary care, everything that we're doing to make sure that the public health infrastructure is secure. And so we continue to use every opportunity we can to promote vaccinations, because we know it's safe, we know it's effective, and so we want to do the best for our communities.
Unfortunately, we've run out of time. I really want to thank our great panelists for discussing this and really educating the public, which is so important. Thank you for joining us.